This surgery reconnects the ends of a nerve that has been cut. It gives your nerve a better chance of healing properly. But even after the nerve has fully healed, your finger may not feel or work the way it did before the injury. To begin, we give you medicine to put you to sleep, or you may be given medicine to make you feel relaxed and numb. We make one or more incisions to reach the ends of your damaged nerve. A surgical microscope lets us see the nerve clearly. Now it's time to repair the nerve. There are different methods we use depending on your needs. If the ends of the nerve have separated, we need to pull them back together. We may need to trim the ends so they fit together neatly. Then we may be able to use glue or sutures to reconnect them. But if there's a gap between the two ends, we need to bridge that gap. We could secure the ends in a hollow tube that will let them grow back together and reconnect. Or we could take a small piece of nerve from somewhere else in your body to fill that space. Your doctor will use the method that will give you the best outcome. When it's done, we close the incisions in your skin, then bandage and splint your finger. Nerve fibers grow slowly, so your healing process may take several months. Follow your care tips for a safe recovery.